Well, in these times, we have been so aware of viruses and infections as we all try to stay safe. It is Infection Prevention Week, and joining us to talk about this important topic is Keith Grant. He is the Senior System Director of Infection Prevention with Hartford HealthCare. Keith, welcome.
Hi, how are you doing?
Oh,
Thanks for having me.
Thank you. Thank you for coming back. Infection Prevention Week, perhaps a good time for a refresher. How can we be preventing infection?
Absolutely. You know, I just want to say Happy Infection Prevention Week to all infection preventionists out there. I think over the last few weeks we've seen, or last few months during this pandemic, we've seen exceptionally committed work from this group. But this is a group that's probably the smartest set of people I've worked with. That's been working around the clock even before this pandemic to ensure that reduce the spread of infection to patients in our community. I think you know, going forward, and we can say the same message that we've always been saying, message that we've seen that work in Connecticut: proper social distancing, ensuring that you're wearing your mask, appreciate the time you spend with your family, but do that safely, and to ensure that you're using proper hand hygiene as well. Another important piece of it is ensuring that if you have symptoms, stay away from crowds and crowded areas, and communicate.
All right, talk about how important is it to get a flu shot this year?
Yeah, so flu shot, you know, every year we see significant complication with the influenza virus, and the flu vaccine we know helps significantly to reduce that. And especially in this time, we have another layer of complication, which is the COVID-19 virus. You want to ensure that you get your flu shot. It's another layer of protection you want to ensure that you're getting, especially if you're within that. Any vulnerable population, get the flu shot as soon as possible.
If someone tests positive for COVID, when is it safe to get that flu shot?
That's a good question. So this is a question that I've been getting a lot of. So one of the primary things you want to think about is whether or not the COVID virus actually impact the efficacy of the flu vaccine. There's no studies that's supporting that at this time. What we do know, and you know, we'll talk about, is the fact that you want to limit the exposure. So I'd say at least 10 days after that first positive, you want to give that time frame. You know, there's enough data that shows the time of infectivity has reduced. So I'd say about 10 days after that positive test or onset of symptoms.
Gotcha. Okay. With the recent uptick in COVID cases in Connecticut, have we let our guard down? What are your thoughts?
You know, we've all predictive model pointed it to this, right? And for a number of reasons. The colder it gets, the more people spend inside. So that's one. The other thing is the more the numbers go down, the more people start appreciating or expecting the return to normal. This is a normal human reaction, and we kind of expected this. So I hate to say yes, it's a lowering of your guard, because people has put so much effort into getting us to this point. But I have to agree. I think we need to be vigilant. Proper hand hygiene, wear your mask, and stay away from crowded areas, and communicate and maintain social distancing.
All right, Keith Grant with Hartford HealthCare, thank you once again for sharing your insight.
Absolutely, guys. Be safe.